Imagine a sudden medical emergency, where every second counts and decisions must be made with lightning speed. You might wonder how a person's age plays into these critical moments, especially when facing something as serious as a stroke. When it comes to stroke treatment, patient age certainly affects the choices doctors make. However, it is important to understand that age is rarely the only deciding factor. Instead, healthcare providers look at a complete picture of the individual's health, rather than just their years. The reason age is a consideration stems from several key factors. Older individuals may have more underlying health conditions, often called comorbidities, such as heart disease, diabetes, or kidney issues, which can complicate treatment. Their blood vessels might be more fragile, increasing the risk of bleeding with certain medications like tissue plasminogen activator, or TPA. Furthermore, the brain's resilience to injury and its capacity for recovery can change with age. A person's physiological age, which is their overall health status, often weighs more heavily than their chronological age. To navigate these complexities, it is vital to provide the medical team with as much information as possible about the patient's medical history. This includes current medications, previous surgeries, and any chronic conditions. Do not hesitate to ask questions and engage with the doctors and nurses. They will evaluate each case individually, considering both the potential benefits and risks of treatments like clot-busting drugs or mechanical thrombectomy, which is the physical removal of a clot. A key principle in stroke care is that time is brain. This means rapid assessment is always crucial. However, advances in medicine mean that even older patients who once might have been considered unsuitable for aggressive treatments are now being safely and effectively treated. Current guidelines increasingly emphasize individualized care, ensuring that every patient receives a comprehensive evaluation by a multidisciplinary team, potentially including neurologists, neurosurgeons, and geriatric specialists. Ultimately, the goal is always to maximize the chance of a good recovery and preserve quality of life. By focusing on a patient's overall health and unique circumstances, rather than just their age, doctors can make informed decisions that offer the best possible outcome for each person who experiences a stroke.